Hi James, how are you today?
I'm fine, thank you.
Good. So tell me what I can do to help you today.
Well, I've been having troubles with my knee over the last 2 or 3 months. I've developed a pain in it. Not always, it doesn't bother me when I'm at rest or even just on my walking, but sometimes when just the foot twists out in a certain way. I notice it, and especially when I'm on the golf course, that's where I first felt that there was something not right there. So I thought, rather than let it get worse, I would come in and get something done about it.
Okay, and tell me a little bit more about the pain. When did you first notice it and how does it affect you?
Well, this is probably 2 or 3 months ago, again on the golf course, and I just noticed there was a sharp pain in the inside of my right knee.
Mm-hmm.
I have had a procedure on my knee before, about 12 years ago. It was a torn cartilage, so I suspect that might be what is the problem this time, but that's what I'm here to find out.
And you mentioned you're a keen golfer.
Yes, and I ski in the winter too, so I'm thinking ahead here, says, well, there is something wrong, let's do something about it now, so I'm fit to do my sporting activities next year.
Yeah, so it sounds like that's part of your key aim, to make sure that you're fit to do the things.
Well, that's right, and when you get to my age, you're going to keep an eye on these things. They don't get any better on their own, so I think it's sensible to do something about it before it gets to a stage where it's worse or cannot be properly fixed.
Yeah, no, I absolutely agree with that. I think prevention is better than cure.
Yes.
And if we talk a little bit more about the actual pain itself, so you mentioned that you notice it when you play golf and during particular movements, is that right?
Particular movements, moving my right foot, if it moves outward at a certain angle, there's quite a sharp pain in the inside of my knee. As I say, it doesn't bother me particularly many other times, although I'm aware of it sometimes in bed as well, if it's turning and I notice it, but it's mainly this outward turn of my foot.
Okay. And is there any other activities that you notice that in, such as stairs or?
No, not really, but just sometimes you can't catch your foot and it turns it outwards. That's when I notice it as well, and I'm aware of it then.
Okay. And have you noticed any swelling at any point?
Nothing that I could see, no.
And would you describe the pain as bad enough to need to take painkillers, or?
No, not yet, but hence the do something now before it does.
Yeah. And with the amount of golf that you currently play, does it limit you in your ability to complete that? Have you had to modify your activities?
Well, there's a lot of things that limit my golf, but that's a new one on me. But no, but I'm aware of it, and I expect maybe a couple of times around I'll twist it in such a way that I will feel it, and it's quite painful.
Okay. And you mentioned that you previously had an issue with your knee.
Yes.
With meniscus. Tell me a little bit more about that.
Well, that was again finding pain in my knee, although it was more when I was bending down or squatting, if you like, and it was sometimes would click. It certainly was quite painful at times.
Okay.
So this feels slightly different, but in the same sort of area.
Okay, does it maybe feel less severe than it might have had last time?
I think so, but perhaps the last time I let it carry on a bit longer, because at that time I was working full time, so these considerations come in to say, right, what am I going to do about this? Can I time off work and things like that? Now I work sort of part time and under my own control, so I'd probably come in to see you earlier than I might have otherwise.
Good. And in terms of your general health, are you otherwise medically fit and well, would you say?
Yeah, it's pretty good, I think, for my years. Like everybody, we could be better, but I enjoy health. I can do the activities I want to do, and it's being in the health professions myself. It's something I'm aware of, and I look after myself pretty well. I hope. Sometimes it's not as good as others, but that's just being human.
Good. Well, we certainly want to make sure that we do everything we can to help you maintain that. Perhaps this would be a good time for us to have a wee look at the knee. So if I maybe get you to pop up on the sofa and we'll have a look.
Okay, that's fine.